We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers on the rise throughout the country and beginning to increase again here in Florida, many residents are questioning what we should do next. Face masks are required throughout many Central Florida communities, and testing sites are opening to accommodate the numbers. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor Jerry Demings to give us an update on what's going on here in Orange County. Mr. Mayor, thank you for joining us today.
Oh, it's all going well, Clarence. It's always good to be with you on the show.
From your vantage point, how are we doing here in Orange County when it comes to fighting the spread of coronavirus?
Well, within the last couple of weeks, we have seen a slight uptick in the total number of cases here within Orange County. We were hovering around 5% for several weeks, and within the last week to 10 days, our rate is now hovering a little over 6%. So we have over 500 people who have died, unfortunately, of the virus within our community. And we do see each day just a few additional deaths. So the virus is still amongst us. So we still have a challenge before us. And really, since we've been dealing with the virus now for about 8 months, I know that people in our community have grown somewhat weary and tired. But the simple things that we can do, like wearing a facial covering, washing our hands, and watching our social distancing, are the things that will really pay off dividends to us in many ways. We can prevent the spread of the virus and prevent additional people from dying from it.
Are masks and safe distancing working, or will we eventually need to move to a mandate?
Well, at this point, we have a mandatory order in place here within Orange County that individuals went out in public spaces, they're supposed to be wearing facial coverings. However, we do not have any penalties to date, but what we are doing is sending out our compliance, our strike teams into the community to be proactive and provide all of the information that a business needs to comply with the mandatory order itself. We are providing personal protective equipment to our businesses free of charge. We have provided collateral materials that really suggest the signage that should be in place at the various businesses, and all of that seems to be going well. Overall, we are somewhere around 90% of the businesses that we approach and go in to inspect are complying with all of the CDC guidelines that have been recommended. So I have to say thank you to our community for stepping up to the plate and for doing what we've asked them to do. Overwhelmingly, the majority of people in our community do wear the facial coverings, and we just look forward to getting through the next perhaps 3 to 4 months before we'll see a widespread vaccine that is available here within our community.
A lot of people are wondering, are we still distributing CARES Act funds, and is the Eviction Diversion program still in place?
Overall, the crisis assistance efforts are going very well. On November the 4th, we reopened our portal for individual and family crisis assistance. Some 15,000 individuals were able to access the portal. We look to open that again on November the 16th will be the next time that we will open up the portal here within our community. And we hope that individuals who are struggling with paying their bills will take advantage of the individual and family crisis assistance that we will be providing. They can get up to $1,000. They must be residents of Orange County, and they could not have been individuals who have taken advantage or benefited from the process in the past. We're trying to assist as many people as we possibly can. So if you've applied before and received the $1,000 grant for your household, then you will be ineligible for the current round of acquisition. Our eviction diversion program seems to be going very well. This is to assist individuals who have received an eviction notice from a landlord. And if the landlord and the tenant agree to work out an arrangement, we will assist the landlord and the tenant with a payment up to $4,000 if they are in arrears or they're behind on their monthly rent payments. It's not for mortgage payments, but for individuals who are renting. And so that is what we're doing to ensure that individuals are able to stay within their homes. We're trying to not increase the number of homeless individuals in our community while we struggle to get people back to work. I believe that it will likely be several months before we see significant return or upticks in our local economy. That will put us right after the first of the year in January, February of 2021. I believe that the most optimistic periods of time for us looking forward.
Can you give us an update on the efforts of the Strikeforce teams and how that's working out?
Well, what we expect business owners to do is to make certain that they are requiring their employees to wear facial coverings, that they are posting signage outside of their places of business that require individuals who are going to be entering to wear their facial coverings. If it's a restaurant or bar, when individuals are engaging in drinking or actual eating or partaking of food, certainly they can remove their mask at that time, but other times we really expect individuals to continue wearing their facial coverings. When we look around the country at other large urban or metropolitan areas that are going through a significant uptick of new cases of the virus within their community, it is primarily related to the fact that individuals have attended events in large crowds and they were not wearing facial coverings. So we know that this works. The science behind it is proven, and at this point we just want our citizens to stay in the battle that we have before us and continue to adhere to those various CDC guidelines that we have recommended.
Anything else you'd like to add?
Well, as we approach this holiday season, we know that it's going to be a tough period of time. Many people will continue to be out of work. But look to a toy drive that we'll be doing here with Orange County. We are doing it in partnership with the local Fox News affiliate. We'll be doing some online shopping where individuals who want to give back to children in need here within our community. We have information on our website at ocfl.net/toy drive. If you want to assist families during this upcoming holiday season, there's a way for you to be able to do that. So let's get through this together, and I believe that we can take care of our community if we do that in unity.
Thank you for joining us today, Mayor Demings. We appreciate your time.
All right, thank you very much for always having me on the show.
We'll be back with more. Stay with us. Let's get an update from our local medical professionals. And joining us is Dr. Thomas Prince, Medical Director with the Florida Department of Health in Orange County. Dr. Prince, thank you for joining us again and being with us today.
Thank you for having me.
So, Dr. Prince, are the coronavirus infection numbers going up here in Florida, specifically in Orange County?
Yes, Clarence, they appear to be going up at this time. They certainly do.
And are we seeing the kind of increase that we were anticipating because we knew that things were changing around the country, or is this something that's caught health professionals off guard?
Well, I think the truth is, Clarence, is that we have known for a while that we were going to have a second wave or third wave, perhaps, and we have been anticipating an increase in numbers. I think that the World Health Organization and AMA publication recently pointed out that probably only 9–10% of the people in the United States and in the world have been exposed to this virus at this time. So there's lots of people for this to spread to. And so when it's given an opportunity, and recently with the opening of schools and with people kind of being a little bit lax about their prevention, their masking and so forth, more open meetings of people, larger numbers of people and less masking. I think that this was very much anticipated. You just don't know when, what day it's going to happen, but this is something we anticipate to go on. It's going to vacillate around a certain number until the majority of the people have either gotten immunity or we found some sort of cure for this disease.
And we also are at that time of the year that was talked about in early 2020, where flu season would begin, and we still are dealing with the coronavirus. So I want to break down for people who should get a flu shot. So we're talking about now seniors, pregnant women. What is your view on who should get a flu shot and when?
Right now, as you pointed out, we have the coronavirus in circulation, and we are coming into the flu season. We've begun it, and peak flu season is yet to show up. But we anticipate the flu to be circulating around as well. And the problem is that both of these are respiratory viruses, and they both can cause trouble. You know, we've talked about COVID deaths, but the seasonal flu kills somewhere between 20 and 60,000 people in the United States each year. We haven't reacted to that in quite the same way we reacted to the COVID, but it's a significant issue, and the potential for having both COVID and the flu at the same time is, to be honest with you, a pretty mind-boggling idea, the potential harm that could cause. And also, quite frankly, if we can get people vaccinated with the flu and prevent them from having the flu, then when they go to the hospital with the respiratory illness, it'll be easier for us to distinguish whether or not they have particularly COVID. As it is now, they might have one or the other, and their treatments are different. So it's important that people get vaccinated. The recommendations on vaccination are pretty much after 6 months of age and beyond, with just some very few exceptions.
And there are a couple of flu shot events coming up. Can you tell us about those?
Yes, I can tell you that that both the county government and the Department of Health has events planned, and I would recommend that that the people listening in the audience go to our website for the Florida Department of Health in Orange County and look at what those are, because there are a number of events that are planned right now, and there'll be a number of events in the coming months. There's no question about that.
And we are at a period of time where, this is uncertainty for a lot of people. Do you have any words of wisdom, health advice that you could leave us with to help us navigate through this period of time where we have the flu and the COVID pandemic?
Well, the one thing holds true of both of those viruses. Obviously, there's an advantage with the flu, and we have a functional vaccine, and we certainly hope to get a functional vaccine for COVID in short order, and it probably will be short order. But beyond the vaccine, the simple behavioral changes of having some social distancing, of washing your hands on a regular and frequent basis with soap or alcohol, of covering your cough and sneeze, masking, staying home when you're sick or feeling ill, or have got a upper respiratory type of infection, of contacting your healthcare provider if you're developing severe symptoms of a respiratory disease. All those things are doubly valid now that we have both of these things in circulation.
Well, Dr. Prince, we appreciate you joining us from the front lines and keeping us informed on how to navigate through this pandemic. Thank you so much.
Yes, sir, my pleasure.
And we'll be right back with more, so stay with us. More than 84,000 residents and staff of nursing homes and other long-term care facilities have died from COVID-19 nationwide. Now, these deaths represent roughly 40% of all coronavirus fatalities in the U.S. And to monitor how this pandemic is impacting nursing home communities, AARP created a COVID-19 dashboard. Ingrid Collins with AARP is back to explain how this dashboard works. Ingrid, thank you for being with us today.
Thank you for having me.
So tell us about this COVID-19 dashboard, how it works.
Yes, thank you. So this dashboard is really intended to be helpful in tracking how states are managing the coronavirus crisis. It not only aggregates, but also analyzes self-reported data that's coming directly from the nursing home. And it's available through the CMS, which is the Centers for Medicare and Medicaid Services. It looks at 5 key issues, 5 key measures. One is resident deaths per 100 residents, resident cases of COVID per 100 residents, the staff cases per 100 residents, and then the last 2 are the percentage of nursing homes that do not have a 1-week supply of PPE on hand, personal protective equipment, and finally the percentage of nursing homes that happen to have staffing shortages.
So is the data just nationwide, or does it show any local data?
No, it's not just national. So the data is compiled at federal, but also at state levels based on that CMS data that I mentioned earlier. The dashboards are updated every 4 weeks, and they're intended to track those trends over time. We also could expect that these dashboards could evolve to include more categories at some point in the future.
So can you tell us what the Florida findings look like?
Yeah, absolutely. It is important to note, and I want to stress that these dashboards are really a 4-week snapshot in time, right? Currently, the dashboard is showing reporting data that ended on September 20th. And at that point in time, Florida was comparing to the national average favorably in only 1 out of the 5 key measures. So the COVID cases were slightly higher than national average at that time. The COVID deaths in facilities were slightly higher than the national average. We were experiencing higher shortages of PPE again at that time. And the one where we were doing slightly better than the national average was we have fewer shortages of direct care workers at the time. But again, that was a 4-week in time snapshot. So it is important to check back for updates because as we all know, we've seen those all stats related to COVID fluctuate, and particularly when COVID cases happen to surge.
Now, why does this data matter in our efforts to fight the spread of COVID-19?
So it matters tremendously, and AARP always is here to remind our communities that this pandemic is impacting a vulnerable population. We cannot lose sight of that. If we look nationally, we have seen that federal policymakers have been a little slow to respond to how the pandemic is impacting the lives, particularly nursing home residents. And no state has done a good enough job, right? There's no such thing as good enough, right, to stem the loss of life. And that is just something that we cannot forget. So we at AARP really hope that these data trends can help guide policy. Certainly they expand the conversations and help make the best decisions for the vulnerable populations at the local and state and local level. State of Florida definitely has been a leader in sharing data about many of these elements. And it is, in fact, one of the reasons that AARP created this dashboard. We want to help states that aren't as transparent as Florida. And as you know, a lot of people, I'm one of those people who wasn't born in Florida. So while we live here in Florida, and of course we keep an eye on Florida, we know that this is a national issue and that sometimes our loved one happens to live in another state.
You know, it's interesting that nationwide, pretty much nursing home facilities and long-term care facilities have been their own hot spots, so to speak, when it comes to COVID-19. Right. And are there recommendations that AARP puts forth to help protect the residents of those facilities and employees?
Yes, absolutely. AARP has developed a 5-point plan, and the objective is to protect the residents of nursing homes and long-term care facilities, the residents and the staff, right? We want to save lives, and it applies at the federal and state level. So I'll walk you through those. First of all, we want to prioritize the regular and ongoing testing, providing adequate personal protective equipment for residents and staff, as well as the inspectors and any visitors that come to those facilities. The second step is to improve transparency. We want to focus on continuing daily public reporting of cases and deaths in these facilities, communication with the families about discharges and transfers, and the accountability for the state and the federal funding that goes to these facilities. Number 3 is to require access to facilitated virtual visitation, establishing those timelines, the milestones, the accountability for the facilities to help provide that in-person visitation, when it's safe to do so with the proper equipment. 4th is to ensure quality care for residents. We want adequate staffing. There needs to be oversight and access to in-person, the formal advocates called the long-term care ombudsman. They need to have that access. And finally, is to reject immunity for long-term care facilities related to COVID-19. This is really like that 5-point plan. We want there to be, safe access, the proper equipment is required, and of course, it leads to the conversation about policy.
So, Ingrid, how have these steps been working? Are there any success stories that you can share?
Yes, we have, and as I said earlier, the loosening of some of these restrictions, certainly at any time, most especially during this pandemic, but at any other given time, AARP would focus on the isolation that can sometimes happen with residents of facilities who perhaps don't get any visitors or don't have any family nearby. Yes, a big success is that we know today that nursing homes are now required to self-report COVID cases to CMS. The data is required to be made public. This helps families so that they have the information that they need, so that they understand what is happening in not just the nursing home where their loved one resides, but in the nursing home industry in general. And it is this data that we're actually using for that dashboard.
So how does this all work together? Since cases of COVID are starting to rise nationally, how does the dashboard and all the recommendations work together in order to help keep people safe?
Yes, as you say, AARP is definitely concerned, as we all are, about potential surges in cases, the potential shortages in personal protective equipment, testing kits, staffing levels. We're just not out of the woods, so to speak, yet. So all of these things are critical issues that we're concerned about. We also know that maybe not so much here in Florida, but certainly in other areas of our country, we're heading into winter months, and the cold that could come with those winter climates present their own health hazards, including annual flu, seasonal affective disorder, which, like COVID, can affect long-term care residents at disproportionate rates. Drop in temperatures also force many facilities to halt outdoor visits. That has been one of the tactics that has been used successfully to fight this isolation, to allow people to still visit their loved ones and check in on them. These are really things that will continue to be our focus, and that we want the community at large to also be aware of, focus on, and care about.
Well, Ingrid, thank you so much for being with us today, and appreciate the information about the dashboard and all the other work that AARP is doing. Thanks.
Thank you for having me.
And we'll be right back with more. Stay with us. There are countless organizations trying to fight the coronavirus by doing what they do best, serving our community. Joining me now is Zulma Martinez, a nurse at the Taft Neighborhood Center for Families. And Zulma, thank you for joining us today.
Good morning. It's nice to be here.
Now,
Thank you
Zoma,
for having me.
my pleasure, our pleasure. What is your role in working with the Taft Neighborhood Center for Families and the Florida Department of Health?
Well, I've been here for now 24 years, serving the Taft community and the surrounding areas. I service the elementary schools, the schools in the area. I work with senior citizens. I have an immunization clinic also. So we provide multiple services.
Excellent. And you are a nurse, so you are a frontline worker. And how have things changed at the Taft Center since the pandemic began?
Well, unfortunately, in March through pretty much May, we were in the mobile units. So we were doing testing also in different sites throughout Orange County. Unfortunately, it hasn't helped much here because of the fact that now we have to control the people that come in, monitor their temperatures. People have to come by appointments, but we are still, we want to let people know that we are still here to serve them.
So a lot of things take place at our neighborhood centers for families and that people don't know about. Tell us about the services that the Ncfs provide.
Well, we provide multiple services. And as you know, there are 13 neighborhood centers for families throughout Orange County. And services provide from employment coordinator through Goodwill Industries, which in this time is a priority because so many people have been laid off and have lost their jobs. We have mental health counselors throughout the neighborhood centers for families. We work with the Boys and Girls Club of America. We have tutoring programs, ESOL programs. We work with Seniors First, so we serve our senior population as well. During this time, it's difficult because we can't meet. So we try to find ways to provide services through them through a grab and go program. And then we have also health through us and providing immunizations for our children to go back to school.
Excellent, excellent. So how would people get information about reaching out to an NCF if they have a need?
You could either call, I think it's 211 to find out about which center is closest to your area. Or you can call directly to an NCF to find out which one is closest to your area because there's 13. So, and depending on the need of the person, that's how we can help them. And if we don't have a program, if you call us, we'll find which one would serve you best.
Excellent. Well, Zoma, thank you so much for being with us today and letting us know about the resources. Thank you.
Thank you for having me.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus, from local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. We are also here to help you keep making those healthy connections. Stay safe.